So the world has become very diverse, and everybody has some ethnic background. When we say ethnic facial plastic surgery, what we mean is changes made to the face within ethnic norms, meaning it takes into consideration features that are ethnically defines someone's ethnicity, so that you make changes that doesn't make you fit in the group that you belong to. This has to do with how you reshape the eyes. It also has to do a lot with how you reshape the nose and sometimes the jaw and structure of the face. So in general, ethnic facial plastic surgery seeks to balance the face without making features look out of place. So for example, if someone who has an Asian background comes to me and wants some reshaping done to the face, one has to know how the Asian skin responds to surgery and factor it into that surgery when they're planning the surgery. One also has to take in consideration the jaw structure of people of Asian ethnicity, so that all the surgical techniques that are developed will be congruent with their ethnicity. The same is true for someone of African background. They are prone to scarring. So whereas in one particular ethnic group, incisions can be liberally made, in someone with an African background, you would be very careful where you place incisions. So all these features and means of wound healing are factored into the ethnic sensitive facial plastic surgery. So ethnic sensitive rhinoplasty is a term that is being increasingly used to define nasal reshaping that is ethnically congruent. What do I mean by that? If I see anyone of Hispanic background, there are some features on their face that tells me this is a Hispanic patient. If I put a nose on that face that looks African American, that nose may look good in pictures, but it's totally out of place. The same will go with me putting a classically Caucasian nose on an African face. It may look good, but it's out of place. So ethnic sensitive rhinoplasty will be rhinoplasty or nasal reshaping that gives a natural looking nose that fits the remaining ethnic features. Of course, everyone who comes for nasal reshaping may not like certain features or aspects of their nose that they want to reshape. And as we are considering and planning the surgery, we have to take overall look of their face and make sure that everything that we change balances. In the end, an ethnically sensitive rhinoplasty looks good, it looks natural, doesn't look operated, and it's not the center of attraction when it's done. So people communicate with the nice looking eyes and not with the nose. There are some individuals, and it tends to be isolated to some ethnicity, but not exclusively, who may have very strong features that may make them either extremely feminine or masculine. For example, common among Asian females will be a strong square jaw, which are features that we tend to see in the male population. And there are some specific surgeries designed to change the shape of the jaw to make it more feminine. There are various terms that have been used to describe it. A common term is called the Asian V-line. And what do we do? If you have an outstanding jaw, angle of the jaw that makes it too strong for a feminine face, we have an ultrasonic dissector that we can go in through the mouth and sort of contour the jaw and make it get a nice cleavage and give a very ethnic looking, defined feminine looking face. In some cases, a very strong cheek. That is just out of place. Someone has a slender, oval looking face, but a thick, big cheekbone or jawbone that throws all the picture out of balance. In jaw reshaping, we can really carefully and precisely reshape those bones to give a feminizing look. On the opposite hand, a male may have a feminizing look, no strong jaw, weak chin, and there are things that you can do to contour those bones to give them a very strong chiseled look. To start off with, doing your research is very good. Number one, you want to go to a surgeon who is very comfortable doing that procedure. Secondly, you would like someone who really understands your goals, because I believe one of the most common reasons that people are not satisfied with facial plastic surgery is their inability to communicate with their surgeons exactly what they want. It's always my goal that if to make my patients happy, and to do so, I'd have to know what exactly they want, and they have to have a means of communicating with me what they want. So first, be sure that you are comfortable with the person you're consulting with, that you can communicate your goals with them clearly. Be open to they telling you that this cannot be done, and also kind of factor it as you make your decisions. Also, go to someone who works with a team that nurtures good outcome. It's very good that the anesthesiologist who works with the surgeons are very capable, because this usually is an elective surgery and you want to go in safely and come out safely. The aftercare is also very important, so you should look at the whole team, a team that can work towards getting the best outcome for you. So at Johns Hopkins Division of Facial Plastic Surgery, we have a focused interest in ethnic sensitive surgery. What do I mean by that? We have found ways to analyze noses of every ethnicity, faces of every ethnicity. We've done research to support this, and we always push to get the best outcome for our patients. If you choose to have your ethnic sensitive surgery done here, we will do everything to make sure that the experience will be excellent for you.